Psoriasis is actually a skin disease and a systemic disease. We are used to seeing psoriasis in the skin as dermatologists, but we know through studies that it can affect the joints and other internal organ systems as well.
If I feel that a patient is an appropriate candidate for systemic therapy or biologic therapy, I want them to understand that we're treating their whole body and not just the cosmetic aspect of it or just the superficial aspect.
Psoriasis is an inflammatory disease with many co-inflammatory diseases. And whether that is psoriatic arthritis or other disease states that we're learning more and more about.
I know the IL-23s have data for psoriatic arthritis as well as psoriasis. I'll generally select the 17. I try to tailor the treatment for both. The anti-TNF-alpha drugs are historically good, but the 17s work better for the skin.
Indications. COSENTYX secukinumab is indicated for the treatment of moderate to severe plaque psoriasis, PSO, in patients 6 years and older who are candidates for systemic therapy or phototherapy. COSENTYX is indicated for the treatment of active psoriatic arthritis, PsA, in patients 2 years of age and older. COSENTYX is indicated for the treatment of adult patients with active ankylosing spondylitis, AS. COSENTYX is indicated for the treatment of adult patients with active non-radiographic axial spondyloarthritis, NR-AxSpA, with objective signs of inflammation. COSENTYX is indicated for the treatment of active enthesitis-related arthritis, ERA, in patients 4 years of age and older. COSENTYX is indicated for the treatment of adult patients with moderate to severe hidradenitis suppurativa, HS. Important safety information. Contraindications. COSENTYX is contraindicated in patients with a previous serious hypersensitivity reaction to secukinumab or to any of the excipients in COSENTYX. Cases of anaphylaxis and angioedema have been reported during treatment with COSENTYX. Warnings and precautions. Infections. COSENTYX may increase the risk of infections. In clinical trials, a higher rate of infections was observed in COSENTYX-treated subjects compared to placebo-treated subjects. In placebo-controlled clinical trials in subjects with moderate to severe PSO, higher rates of common infections such as nasopharyngitis, 11.4% versus 8.6%, upper respiratory tract infection, 2.5% versus 0.7%, and mucocutaneous infections with Candida, 1.2% versus 0.3%, were observed in subjects treated with COSENTYX compared to placebo-treated subjects. A similar increase in risk of infection in subjects treated with COSENTYX was seen in placebo-controlled trials in subjects with PsA, AS, and NR-AxSpA. The incidence of some types of infections, including fungal infections, appeared to be dose-dependent in clinical trials. In the post-marketing setting, serious bacterial, viral, and fungal opportunistic infections and some fatal infections have been reported in patients receiving IL-17 inhibitors, including COSENTYX. Cases of hepatitis B virus reactivation have been reported. Exercise caution when considering the use of COSENTYX in patients with a chronic infection or a history of recurrent infection. Instruct patients to seek medical advice if signs or symptoms suggestive of an infection occur. If a patient develops a serious infection, monitor the patient closely and discontinue COSENTYX until the infection resolves. If signs of hepatitis B virus reactivation occur, consult a hepatitis specialist. COSENTYX is not recommended for use in patients with active viral hepatitis. Pre-treatment evaluation for tuberculosis. Evaluate patients for tuberculosis, TB infection prior to initiating treatment with COSENTYX. Avoid administration of COSENTYX to patients with active TB infection. Initiate treatment of latent TB prior to administering COSENTYX. consider anti-TB therapy prior to initiation of COSENTYX in patients with a past history of latent or active TB in whom an adequate course of treatment cannot be confirmed. Monitor patients closely for signs and symptoms of active TB during and after treatment. Inflammatory bowel disease. Inflammatory bowel disease, IBD, exacerbations, in some cases serious and/or leading to discontinuation of COSENTYX, occurred in COSENTYX-treated subjects during clinical trials in PSO, PSA, AS, NRX-SPA, and HS. In adult subjects with HS, the incidence of IBD was higher in subjects who received COSENTYX 300 mg every 2 weeks, ulcerative colitis UC 1 case, EAIR 0.2 out of 100 subject years, Crohn's disease CD 1 case, EAIR 0.2 out of 100 subject years, compared to subjects who received COSENTYX 300 mg every 4 weeks, IBD 1 case, EAIR 0.2 out of 100 subject years. In addition, new onset IBD cases occurred in subjects treated with COSENTYX in clinical trials. In an exploratory trial in 59 subjects with active Crohn's disease, COSENTYX is not approved for the treatment of Crohn's disease. There were trends toward greater disease activity and increased adverse reactions in subjects treated with COSENTYX as compared to placebo-treated subjects. Exercise caution when prescribing COSENTYX to patients with IBD. Patients treated with COSENTYX should be monitored for signs and symptoms of IBD. Eczematous eruptions. In post-marketing reports, cases of severe eczematous eruptions, including atopic dermatitis-like eruptions, dyshydrotic eczema, and erythroderma, were reported in patients receiving COSENTYX. Some cases resulted in hospitalization. The onset of eczematous eruptions was variable, ranging from days to months after the first dose of COSENTYX. Treatment may need to be discontinued to resolve the eczematous eruption. Some patients were successfully treated for eczematous eruptions while continuing COSENTYX. Hypersensitivity reactions. Serious hypersensitivity reactions, including anaphylaxis, angioedema, and urticaria, have been reported in COSENTYX-treated subjects in clinical trials and in the post-marketing setting. If an anaphylactic or other serious allergic reaction occurs, immediately discontinue administration of COSENTYX and initiate appropriate therapy. The removable caps of the COSENTYX Senso-Ready pen and the COSENTYX 1 ml and 0.5 ml pre-filled syringes contain natural rubber latex, which may cause an allergic reaction in latex-sensitive individuals. The safe use of the COSENTYX Senso-Ready pen or pre-filled syringe in latex-sensitive individuals has not been studied. Immunizations. Prior to initiating therapy with COSENTYX, consider completion of all age-appropriate immunizations according to current immunization guidelines. COSENTYX may alter a patient's immune response to live vaccines. Avoid use of live vaccines in patients treated with COSENTYX. Most common adverse reactions. Most common adverse reactions, greater than 1%, are nasopharyngitis, diarrhea, and upper respiratory tract infection.